It's another week here on Fire Your MD Now. Thank you so much for tuning in. I'm Dr. Peter Glidden, your friendly neighborhood naturopathic physician, and this is the show where we punch holes in the myths surrounding medicine and medical care as it's delivered in a for-profit medical monopoly in the United States of America circa the 21st century. As a licensed naturopathic physician, I've had 4 years of pre-med. I did that at the University of the University of Massachusetts in Amherst. 4 years of naturopathic medical school at Bastyr University in Seattle, Washington. Currently, there are only 5 academic institutions in the United States which license the practice, which teach naturopathic medicine from an accredited academic institution. You got to do 4 years pre-med, 4 years naturopathic medical school, 900 to 1,000 hours of clinical supervision. You have to pass national boards, pass state boards, and do approximately 23 hours of continuing education credit a year. It's a full-blown medical degree. Now, naturopathic physicians are trained in anatomy and physiology and pathology of disease, diagnostic procedures, the use of X-ray and CT scan, and you name it, just like MDs are, the diagnostic procedures just like MDs are, and we're also trained in a handful of prescriptive medicines the same way that MDs are, and minor surgery. As a naturopathic physician in the state of Washington, I can deliver babies, prescribe drugs, perform minor surgery, work in hospitals, legally refer to myself as a physician. And it's order any diagnostic test I want to, and it's all covered by insurance. Pretty great. Now, if I was to do exactly the same thing in Chicago that I did in Seattle, Washington, I'd be thrown in jail for a year and fined $5,000 for practicing medicine without a license, and that's just not right. We do not have a free medical market here in the United States. We haven't since the 1920s after something called the Flexner Report. It's gone. We do not have a free medical market. The only medicine that your insurance pays for is MD-directed medicine. The only medicine that's practiced at your hospital is MD-directed medicine. The only medicine they teach you about in school is MD-directed medicine, and MD-directed medicine is just one facet of medicine. MDs do not own the medical theater. They do not own medical science. They are trained in one aspect of medicine, one aspect of medical science only. It's referred to as allopathic reductionism. MDs are trained to look at the body like it's a machine made of parts. MDs are trained to march in and deliver therapeutics to the body, which are made from synthetic drugs, the intention of which is to override, overpower, and control the innate, inherent workings of the human body. Allopathic MDs are trained to believe that the human body does not have the ability to fix itself. Now, once you're sick, you're screwed, and the only recourse that anybody has is either to surgically remove the affected part or take a drug that's going to override, overpower, and manage the inherent workings of the human body. So from an MD's ridiculous point of view, short-sighted point of view is a better way to put it, you can never recover from type 2 diabetes. You can never recover from arthritis. You can never recover from heartburn. You can never recover from high blood pressure. You can never recover from insomnia or anxiety and panic attacks or obesity. These things are built in. Once you're sick, you're screwed. You can manage these conditions with prescription medicines. Now, that's pretty good for the drug companies, don't you think? Can't ever fix the arthritis, but you can take the pain medication for months and years and decades until it kills you or destroys your liver, and then we'll just put you on a liver transplant list, or it wipes out one of your kidneys. Oh, that's okay, you can live with only one kidney. Or, we'll just medicate the pain into submission until the joint gets so bad that we'll just surgically remove it and put a fake joint in its place. This is how MDs are trained to think. It is trained obsolescence. And from my point of view, MDs are trained in a colorblind. MDs are like colorblind art critics. They do not see the greater scope of things. And the greater scope of things in this regard is the fundamental relationship between nutrition and the health of the human body. MDs have no training, no experience, no perspective in medical nutrition. Zero. They don't have any perspective on it whatsoever. Now, given the fact that the majority of chronic diseases have their roots in lack of nutrition, there are 278 diseases that are caused by not enough calcium, but your medical doctor does not know this. Simple high blood pressure most of the time is not enough calcium. Chronic low back pain most of the time is not enough calcium. Bad menstrual cramps, not enough calcium. Ringing in the ears, not enough calcium. Vertigo, not enough calcium. But your MD doesn't know this, and there's a lot of things about the interface between nutrition and health that the MD does not know. And if the MD does not know it, the MD is completely clueless, completely unable to do anything about it. If we were pirates and we had vitamized scurvy, all we would need to do is take some vitamin C, it would go away. But if the MD who was treating us didn't know that scurvy was a vitamin C deficiency, he'd throw drug after drug after drug, and then they'd amputate. Well, and that's what we take. We sit down and we take it here in the U.S. because we do not know that there's any difference. Now, this is where we come in, ladies and gentlemen. This show represents the cutting edge of medical nutrition. It's science-based. It's clinically verified. It's been objectified to be successful over with decades of clinical experience. If you're sick and tired of being sick and tired, this is exactly the place to come to get your questions answered. And let's go right to the phones right now to get some questions answered. We have Stephanie from Minnesota, recurring rash on her neck, I think. Stephanie, are you there? Hello, Stephanie. Well, maybe Stephanie's not there. How about Lisa from New York? Lisa, are you there? Lisa from New York.
Hello.
Hello, is this Stephanie
Hello.
or Lisa?
It's
Hello?
Lisa. Hello.
Hello, can you hear me?
Can you hear me? I can hear you. Can you hear me?
Yes,
Hello?
Lisa, you are live on the radio.
Cool.
Are you with us?
I'm here.
Okay,
and I'm
good.
calling for this cough.
Okay, so
12 years of this. Been two allergists, 3 pulmonologists, 2 GIs. Had surgery on my nose, 2 ENTs. Let's see, where else did I go? Cardiologist. Nothing is negative or positive. Everything's negative. But yet I cough every morning until I throw up. And I cough like this all day long for absolutely no reason.
And well, how long ago did this start?
12 years ago.
After what?
After a virus.
Okay, so
I
you had a viral.
virus.
How do you know it was a virus?
Well, because I'm a nurse, and it was viral. It was all clear mucus, fever, body aches. It wasn't bacterial. It was gone within 7 days.
Okay. So do you have any other chronic health conditions, high blood pressure, type 2 diabetes?
Nothing. I take Loratab for the cough. It does control it. Like right now it's controlled.
Okay,
this
what's
is
your
a
height?
Controlled cough.
Okay, good. What's your height and weight?
I'm 5'7", and I'm about 160 pounds.
160?
160.
Okay. And have you lost height in the last decade? Are you shorter than you used to be?
No.
You're not.
No, I'm still the same height.
Okay. And you have no other health complaints? You're ringing in the ears?
No ringing in the ears. So the only thing I have is herniated discs, which make my left leg numb.
Okay, very good. So that's where I was going with the losing height thing. You know, there's a saying in medicine, you're a nurse, God love you. We love nurses, by the way. And I'll tell you a story about that in the next section. There's a saying in medicine that when you hear hoofbeats, you think about horses before you think about zebras, right? You think about the most common things to cause things before you start thinking about more, esoteric things. So with a chronic unyielding cough that is completely, all the diagnostic tests have been run and everything comes back normal. There's no tumor pressing on the pneumogastric nerve. You don't have emphysema. There's no structural change in the lungs, and your blood work looks fine. However, there's a strong and persistent symptom. The most common cause of a strong and persistent symptom in that case is degenerative disc disease. Now, one of the way that degenerative disc disease shows up is with herniated discs. Basically, what's happening here is the intervertebral discs have lost their structural integrity. They have run out of the raw materials that they need to stay healthy. And when the discs run out of the raw materials that they need to stay healthy, they start to become compressed like a feather pillow that's lost its feathers. Now, if that disc that comes out of your thoracic spine, where the nerves come out of your spinal cord that go to your lungs, if those discs have been compromised, and if they're pressing up against one of the nerve or the nerve root that goes to your lungs or to your larynx, it's going to produce a chronic persistent cough. It's like sciatica. It's similar to sciatica. It's a chronic persistent irritation of the sciatic nerve caused by a structural anomaly. So the first thing that I would do is I would assume that this is a disc problem, and therefore I would get on board with a medical nutrition program that supports and promotes the health of intervertebral discs, because we got nothing to lose into this bargain, and it sounds like a pretty smart approach to do. Now, when somebody said something this persistent for this long, the recommendation is a 3-month program. So here it is. We're going to dial it in. We have a minute left in this segment. I'm going to dial it in real quick. Here's what I would do if I were you per month. These are the supplements that I would order. I would order 1 healthy bone and joint pack. Actually, no, you don't need that because it has CM cream in it. 1 healthy start pack.
One healthy start pack.
Yeah, 1 healthy start pack. 1 extra bottle of something called Cal Toddy, CalToddy. 1 bottle of Cal Toddy and 2 bottles of glucogel in the 240 count. 2 bottles of glucogel in the 240 count. Stick with me. I'll tell you. Ladies and gentlemen, Dr. Peter Glidden talking with Lisa, who has a chronic and persistent cough. So here's the rundown, Lisa. Per month, 1 healthy start pack, 1 bottle of something called Cal Toddy, 2 bottles of glucogel capsules in the 240 count, and 3 bottles of Ultimate Selenium. 3 bottles of Ultimate Selenium. Now, I want you to take the selenium, 3 caps, TID, 3 caps 3 times a day. I want you to take the glucogel, which is the secret sauce, by the way, for the intervertebral discs. 5 of those, 3 times a day. 5 with breakfast, 5 with lunch, 5 with dinner. The Cal Toddy is a fantastic liquid calcium. It's one of the best liquid calcium supplements, period, I've ever seen. It's over 95% absorbable, right? It's a fantastic product. That product and a product called OsteoFX Plus, which is in the Healthy Start Pack, those products are thick like paint and they're liquid. So before you take a dose of either of the liquid calciums, I want you to turn those bottles upside down and shake the heck out of them, just like you would mixing a can of paint. Okay, if you don't do that, the last 5 doses are going to be thick like mud. So the Cal Toddy, I'd like you to take 1 ounce in 3 to 4 ounces of cold water immediately before bed. 1 ounce and 3 to 4 ounces of cold water immediately before bed. Take the stuff, brush your teeth, get into bed, just like that. Not an hour before you go to bed. Take it right before bed. The Healthy Start Pack has another bottle of liquid calcium in it. It's called OsteoFX Plus. I want you to take 1 ounce of that in the morning in 2 to 3 ounces of orange juice. 2 to 3 ounces of orange juice, just so you can slam that right down. There's 2 other things in the Healthy Start Pack. An essential fatty acid in a little gelatin cap. There are going to be 90 in that bottle. I want you to take 3 of those with lunch or dinner. I want you to take 3 of the EFAs, it's called EFA Plus, with lunch or with dinner. You have to take that supplement with food or you'll be burping up fish oil all day long. The last thing in our support and promote the healthy intervertebral disc program is the Beyond Tangy Tangerine multivitamin, multi-mineral, multi-amino acid, multi-antioxidant red powder. It's in a canister. My recommendation for that is 1 scoop in 16 ounces of water twice a day. Now, if you're working and you can't handle that, you can't manage that, you can put 2 scoops in 32 ounces of water and sip from it all day long. If you do the 16-ounce gig, I want you to take at least half an hour to drink that down. I don't want you to just chug it down. And if you do the 2 scoops in 32 ounces, I want you to take at least an hour to drink that down. So that's the supplement program for 90 days here, 90 days. And in order to top this off, the whipped cream and the cherry on top here, please go to fireyourmdnow.com and download for free my good food, bad food list. There are 10 foods we don't want anybody to even look at, let alone eat. So you eliminate those 10 foods from your diet completely. It's pretty easy to do. Take these nutritional supplements, and all things being equal, your symptoms should start to subside every couple of weeks. There should be improvement. Remember, this isn't just an intervertebral disc, program. Support and promote the health of the intervertebral disc. This is a support and promote the health of Lisa from New York. This is a comprehensive medical nutrition program, and it should have positive effects. It will have positive effects across the board. You should experience, better energy, better sleep, better mood, better sex drive, better endurance, better everything. Well, it's just like watching ice melt in the springtime, okay? So give that a try, Lisa. Try that for 90 days and give us a call back. Now, folks, if you're trying to reach us and you can't, we have people standing by ready to help you figure out what supplements to take and how you can recover your health. Just give us a call. That's 855-347-3696. That's toll-free, 855-347-3696. You can also get that number by going to fireyourmdnow.com. It's right there on the home page. Now, the number to call in and talk to me today is 866-582-9933. That's toll-free from anywhere in the country, and that's every day, 866-582-9933. We're coming up against another break, ladies and gentlemen. I think Stephanie is still with us. Stephanie, stick around. I'm going to take your questions when we come back on the other side of the break. Ladies and gentlemen, you don't know what you don't know. And when it comes to medicine, the stuff that you don't know will heal you or will kill you. And the only thing that your MD, bless their hearts, are trained in is drugs and surgery. So that's all they have to throw at everything. We have science-based, clinically verified alternatives. Testimonial Tuesday. I'm going to have a testimonial on tomorrow that will make you laugh and make you cry. And if it doesn't make you angry, you're just not paying attention. There is a remarkable, let's look at it this way. If I was the guy that invented the wheel, that would be a pretty remarkable thing, right? Before I came along and invented the wheel, everything was a lot harder. Everything was a lot harder, right? The wheel really made everything a lot easier, and it revolutionized things. It was a really great thing. But, 1 week before the wheel was invented, nobody knew anything about it, and everybody was suffering. And then a week after the wheel, oh, my God, life is easy. Well, that's exactly what medical nutrition is like. That's exactly what holistic medicine is like. But people don't know anything about it because the MDs practicing unholistic, reductionistic pharmaceutical medicine have monopolized the medical playing field. They've made it illegal to practice medicine in the United States unless you're an MD, and they have convinced you that everybody besides an MD is a quack, even though their profession is the leading cause of death in the United States. Even though, while they've been driving the bus, heart disease has remained unchanged. We've lost the war on cancer. Obesity is skyrocketing. Chronic illness is skyrocketing. Bankruptcies due to medical bills skyrocketing while they've been driving the bus. The reason that we pay so much for medicine in the United States and get such horrible results is because MD-directed, reductionistic, pharmaceutical-centrist treatments for chronic disease don't work. It's got nothing to do with insurance profiteering. It's got nothing to do with pharmaceutical, monopolies. It's got nothing to do with the for-profit medical system. It has everything to do with the unrecognized, unnoticed fact, the before-the-wheel invention fact that MD-directed medicine does not work. It doesn't work. It doesn't work. The only thing it's good for is surgery and some nasty infections. That's it. Trauma. They're good at that. For everything else, they stink. Stop going to them. I'm going to give you a perfect example here. We've got Stephanie calling with a chronic and persistent rash that our good friends, actually they're not our good friends, they're not my good friends, the MDs have been unable to treat. Stephanie, are you here?
Yes, I am.
All right, so bring me up to speed.
Well, February is when it first happened. Went in for antibiotics and prednisone. They called it idiopathic because they couldn't decide whether it was inflammatory, bacterial, or allergic. When it went away, and then last week it come back with a vengeance. Looks like a really bad sunburn, very inflamed, can be very hard at times. It oozes and weeps, and then it crusts over, and now it's starting to spread again. And it's very tender to the touch. It's like it's got almost like acne-like pimples that start to pop up, and then that's where it spreads to.
Okay. Now, how long has this been going on, Steph?
This round since, well, it's been a week now again.
Well, what about the first time in your life you ever got this?
Probably 2.5 years ago when it showed up on my arm.
And was it on the same side of your body or a different side?
No, it's all been on the left side of my body.
Okay. And when it first showed up, was it as bad as it is now? Was it worse, or was it,
It was just about as bad. It was very pinprickly, hot, very sensitive.
And you never had it before, right?
Never. I was at first when I was first went in for it 2.5 years ago. I was told it was eczema.
Yeah. Okay. Well, when it first showed up 2.5 years ago, was there anything new in your life? Like you just started exercising, or you just lost a bunch of weight, or you just moved to a new town, or you got a new dog, or got divorced, or anything new in your life?
No, other than I blamed it on stress up until that point.
What do you mean stress?
It's just from the job. I'm a portrait photographer, and having to deal with the ins and outs of all part of the job.
Yeah. Okay. All right. So, and you haven't started to exercise. You didn't start a new exercise program a couple of years ago, right?
No.
Hot yoga.
No.
Or,
you know what? I did. I went on this thing called SlimGenics.
And are you still on SlimGenics?
No, I quit after 4 months because I couldn't afford the product they were trying to push me to take.
And SlimGenics involved what? A lot of aerobic workout?
No, it's just basically taking a lot of food out of your diet and then taking their supplements.
Yeah, okay. So it wasn't an increased exercise regime, right?
No.
Okay. All right. Well, there's when we see peculiar stuff in medicine that has a strong presentation, and, we do lab work, we do diagnostic stuff, and nothing is showing up, right? Nothing is showing up. Mm-hmm. When we see that type of an occurrence, what we do in the holistic community is fall back on the belief, it's actually more than a belief, we fall back on the knowledge that the human body has the ability to fix itself. And so what are we going to do? Rather than try to micromanage the biochemistry of your body or actually try to pinpoint 100% with a diagnostic, dead-on diagnostic, code, tell you what this is, what we do is we support and promote the health of the skin and, in this case, your immune system.
Okay.
So, all right. So here's what I would recommend that you do. How much do you weigh?
I weigh 290, and currently I am using the Longevity Healthy Start Pack.
Okay, good. 290 pounds. How tall are you?
5'6".
Okay, good girl.
And I've lost almost 15 pounds since being on it 6 weeks ago.
Yeah, it's pretty great, isn't it? Are you doing the ASAP program or just
Not yet. We haven't been able to get it in.
Okay.
It's back ordered.
Yeah, all right. Yeah, it's going crazy. The ASAP's going crazy. Okay. I'm going to have the guy on that created the ASAP program on Thursday, I believe, God willing, okay. Thursday, so stay tuned. Thursdays, by the way, ladies and gentlemen, in the listening audience, Thursdays is when we do celebrity interviews. This Thursday, I hope to have on board with us the man that brought the ASAP weight loss program to Longevity. You're going to love that interview. Now, so here's what I would do for this. Are you on the gluten-free diet?
I'm getting there, yes.
So that's a no, right?
Up until a week ago, it was completely no. Up until a week ago when this all started happening
you can't like being pregnant. You can't be a little pregnant, right? Oh, yeah, well, I'm just a little pregnant, doctor. Yeah.
No, it's been a week since I've been totally gluten-free.
All right, good girl. So that's important because very frequently when we see chronic, persistent skin stuff, especially if it, shows up and goes away, shows up and goes away, shows up and goes away like that, it can be related to oxidative damage to the 7 dermal layers of the skin caused by consistent consumption of all the wrong food and compounded by lack of nutrition that the body has to keep that part of your skin healthy, kind of like picking a scab. It's just never going to heal. So the main foods to consider eliminating 100%, because we would consider them like prime suspects in our investigation here, would be the gluten-containing foods, wheat, barley, rye, and oats.
Okay.
So you really need to dial that in 100%. I mean, I don't even want you to look at wheat, barley, rye, or oats, all right?
Okay.
Don't even have a crouton, not even one single molecule of wheat, barley, rye, or oats. And it's not that hard to do, actually. And it's kind of fun when you get into it, because I don't know, I don't want to go off on a riff about that. But dial in the Good Food, Bad Food Diet, please. You can download that for free from fireyourmdnow.com. Now, the other thing that we want to do in this case is give your body nutritional support for the skin, because the skin's affected here, right? Mm-hmm. Kind of a no-brainer. So the nutritional support that we provide to the skin, interestingly, is the same stuff that we provide to the joints and ligaments, because they're made out of the same stuff. So in this case, it would be the glucogel. Now, you've got two options here. You've got glucogel liquid and you've got glucogel capsules. It really depends on your budget more than anything else. The glucogel capsules are the most effective way to go here, and the dose is 1 capsule per 10 pounds of body weight. So you're weighing in at 290, so we bump that up to 300. We divide that by 10. That's 30 glucogel capsules a day, right? So that would be 9 with breakfast, 9 with lunch, 9 with dinner. That's 27. That's close enough. Now, I don't know if you can afford that many glucogel. I think that's going to be like 4 or 5 bottles a month. If you can't afford the 300-pound dose, then get the 250-pound dose. If you can't afford that, get the 240-pound dose or whatever. Get as much as you can afford. The glucogels are sold in 240-count bottles for $35 each, 240-count bottles for $35 each. Alternately, you can do the glucogel liquid. Off the top of my head, I don't know how much that costs. The glucogel liquid, though, we dose that at 1 ounce of the liquid. 1 ounce of the liquid, it's $40 for one bottle, $40 for one bottle. 1 ounce of the liquid per 50 pounds of body weight per day. So at 300 pounds, you'd need 6 ounces a day. That would be 2 with breakfast, 2 with lunch, 2 with dinner. If you can't afford that, do 1 with breakfast, 1 with lunch, 1 with dinner. If you can't afford that, do whatever. Okay? But you need to start getting the sulfur-bearing molecules that are in that glucosamine sulfate into the body. And the last thing that I would do in this regard would be selenium. The ultimate selenium is really increases the uptake of sulfur in the skin and in the tissues that need it. It's kind of like a turbocharge for the car, right? So whenever we're trying to support and promote anything having to do with sulfur-bearing molecules on the skin or in the joints, when we add selenium into the mix, it really speeds things up quite a bit. Now, you know, selenium is $24 a bottle. There are 90 capsules in one bottle, and I would recommend for you, 4 bottles of selenium a day, which would be 3 capsules 4 times a day. 3 capsules 4 times a day. That's what I would do if you can afford it. If you can't afford that, then get 3 bottles or 2 bottles or 1. I want you to have at least 1 bottle of the selenium and at least 1 bottle of the liquid glucogel. And for the icing on the cake, get the Longevity Colloidal Silver. It's colloidal silver. It's a little liquid. And I think a 16-ounce bottle, an 8 or 16-ounce bottle, and you want to get go to CVS and get a little tiny spray bottle, right, a little tiny spray bottle. Mm-hmm. Dump the colloidal silver into the spray bottle, and when you get that weepy eruption, I want you to spray the colloidal silver onto it 4, 5, 6 times a day. If there is a viral component, which there may be, because when you get a weepy, sticky, burny eruption like this, it's bells and whistles in my diagnostic brain go off about viral. And viral stuff is kind of tricky because it can be a garbage can diagnosis. A doctor doesn't know what the heck to call it, so they call it idiopathic, right? Mm-hmm. Yeah, well, thanks, doc. That $600 I just gave you, and you tell me you don't know what the hell it is, but rather than being honest saying you don't know what the hell it is, you're telling me it's idiopathic. And what idiopathic means is the guy that made the diagnosis was an idiot. That's the best way to think about that. So spray the colloidal silver on it 4 or 5 times a day. See if that doesn't knock down the time that this sticks around. Clean your diet up. Take those nutritional supplements. Or believe it or not, inside of this domain, the single most important thing for you to do is be gluten-free. Now, you need the nutrients too, but really there's a double whammy possibility here that not only is the wheat, barley, rye oats impairing the absorption of nutrients into your body, but could also be producing a pro-inflammatory effect. So you need to knock that off yesterday. Good job for doing what you've done so far. And if you've lost 10, 20, 30 pounds already, the best is yet to come. Healing is easy. We have been hypnotized to believe that healing is some complicated, sophisticated process that can only be managed by people with white coats and multi-million-dollar high-tech facilities. It's a lie. Healing is easy. I have people working with me, lay people just like you, who have learned the methods of health recovery through medical nutrition. Why? Because it's easy. And they're standing by right now to take your phone calls to help you figure out what you can do right now. No office consultation charge, no insurance copay. We're going to tell you for free what to take to support and promote healthy blood pressure, healthy blood sugar, healthy bones and joints. You name it, we have it dialed in. Speaking about dialing in, it's 855-347-3696. That's the number to call for help with ordering. 855-347-3696. And if you ever forget that number, just go to fireyourmdnow.com. It is right there on the front page. Ladies and gentlemen, healing is easy. Now, if you want to call me and schedule an appointment, no problem. I treat about 100, 150 new patients a year. That's all I have time for. You can do that if you need your hand held. If you want some direct medical care, I can do that. We also have information at 855-347-3696 for how to do that. But check out the nutritional supplements and our game plans, because really, this is the best stuff I've ever seen in over 23 years of clinical work. I think we have Linda waiting patiently with us from Texas. Linda, are you still here?
Yes, I am.
All right. How can I help you? Thanks for hanging on.
Well, I have two things. I have a breaking out in my groin area at times, and an antifungal cream will clear that up. It'll come back maybe once a month. And I also have tendonitis trigger finger.
Okay. So the rash, the fungal rash, how do you know it's fungal? Because you treat it with an antifungal and it goes away?
I guess that's what I do.
Well, here's an interesting thing. This is an old-fashioned naturopathic technique. I want you to go, and this is going to sound funny, but this is a great thing, folks, if you're out there in the listening audience, especially if you have kids or if there's anybody in your life prone to get fungal infections. Go to the health food store and get a fluorescent black light. A fluorescent black light. And like $2-3. Take the black light home and plug it into, a lamp. Take the lamp into the bathroom. Shut off all the lights, block out all the windows, put a towel under the door so there's no light coming in there. Turn the black light on and shine it on the part of your body that you think is infected with a fungal infection. Now, if it is a fungal infection, under the black fluorescent light, that the part of your body that has the fungus on it will pop up bright white. It'll look as white as the driven snow, and it's unmistakable. If it doesn't pop up white under the black light, then it's not a fungal infection. That's an old-fashioned therapeutic naturopathic diagnostic technique. Okay, now I'm going to just assume that it is, in fact, a fungal infection, Linda. The thing that drives fungal infections forward is blood sugar. Blood sugar that's too high. It's kind of like your body is starting to lose its ability to, It's starting to lose its ability to take blood sugar up into the cells of the body efficiently. It's become an inefficient sugar engine. It needs a tune-up. One of the other symptoms of this happening is people get sleepy after they eat a meal, or they wake up in the middle of the night like they're wide awake. Do either of those things happen to you?
Not since I've been on. It's gotten better since I've been on the pig pack.
Oh, well, there you go.
Waking up, yeah. I don't do that.
So that used to happen, right?
Meal, usually.
Okay, good. So what you want to add to the pig pack is specifically that will help this blood sugar issue is a product called Sweeties. Sweeties. I would get 1 bottle of Sweeties and take 3 of those before a meal. Take 3 Sweeties before a meal for a couple of months, and that should round this out, because what we're trying to do here, right, is get to the root cause of what's going on rather than just medicate it. And what you're doing now with the antifungals is just medicating symptoms. For the trigger finger...
For every meal or before one meal?
Before every meal. 3 capsules of the Sweeties before every meal. For the trigger finger, just keep doing the pig pack. The thing that you want to emphasize there would be the glucogel. If you really want to push that envelope, it's 1 glucogel capsule per 10 pounds of body weight per day, so you might need to order more. Ladies and gentlemen, thank you so much, Linda. Thank you so much for tuning in once again. We're here with you every day. Check us out in the meantime at fireyourmdnow.com. I'm Dr. Peter Glidden. See you next time. Same bat channel, same bad time. Over and out.